We're going to talk about positioning a patient who's had a stroke. So this patient has had a right CVA, left hemiplegia noted, and as you can see, she's ill positioned in the bed. And so what we're going to do is we're going to try to get her in a place where her body systems are working properly. The first thing you want to think about is approaching the patient on her affected side, and talking to her and telling her what you're going to do. Okay, so we're trying to promote some attention to the affected side. So good morning, Miss Amy. I'm Jennifer, the occupational therapist. How are you feeling today?
Good. How are you?
I'm good. You're looking a little wonky in this bed. I'm going to get you situated, okay?
Okay.
All right. So since this patient has had a stroke, we can go ahead and assume that she may have some swallowing issues. So we're going to make sure that the head of bed is to 30 degrees before we leave. And we're also going to make sure her call button or anything that she needs is on her unaffected side. Okay? So first things first, Miss Amy, I'm going to get you this arm kind of situated over here. And I'm going to scoot you on your pillow. Okay. I may even raise you to the head of the bed here. Okay. So I'm going to use the chuck, and I'm just going to pull the patient to the head of the bed, and I'm using proper body mechanics here. I'm not pulling with my back. I'm pulling with my legs and my arms, okay? So Miss Amy, now that I've gotten you to the head of the bed, I'm going to position your left arm. Don't say weak, don't say hurt, don't say bad. I'm going to position your left arm on this pillow, okay? That way you can have some lymphatic drainage, okay? We don't want this hand getting swollen, okay? So we don't want it to hang down. And I'm going to talk to your family and your nursing staff about that, okay?
Okay.
We're also going to turn your hips a little bit. So there we go. So we've got her hips and her pelvis square. We've got her affected extremity elevated. And then we're also going to place, because this lower extremity is affected, we're also going to place a pillow under this extremity to float the heel. Now, the reason why we do that is because this extremity is gravity dependent. So we don't want her heel rubbing against the bed constantly, okay? Anytime she moves the rest of her body, we want that heel to have some space under it so that we don't get a wound, okay? So then we're going to elevate the head of the bed to 30 degrees. And I like to do the knees up a little bit too so that they don't immediately slide back down. All right, Miss Amy. And then we're going to ask the patient if they're comfortable. So how does that feel? Is that any better?
Good.
Okay. All right. So I'm going to talk to your family about positioning you this way just for safety and so that all the parts of your body are going to work properly when we decide to get out of this bed.
That'd be good.
All right. Thank you.